Are there advantages to aging? Yes, I am Debbi-Jo Horton, and welcome to Advantages to Aging. Join my guests and I as we discuss aging and what makes for a healthy lifestyle, which results in a quality life. Thank you for joining me today. Hi there, listeners. This is your host, DJ Horton, with Advantages to Aging, and I am welcoming back Dr. Green, who is the Chief Medical Officer at Winona. And if you recall, and if you haven't listened, you've got to go listen. We were talking about menopause and hormone replacements and the history. Today, we're going to talk a little bit about who's a good candidate for hormone replacement and when should you get started on it. So welcome back, Dr. Green. Can't wait to hear all of your knowledge.
Well, thank you so much. I appreciate the opportunity to share it.
Excellent. So who is a good candidate?
Hormone replacement therapy is safe for most women, but there are some women that it's not safe for. The big sort of rule out things that would make somebody not a good candidate. Number one, age over 60, where they have never been on hormone replacement therapy and they're over 60 years old. That's considered a high risk category. The second one would be a history of heart disease. So if you've had a heart attack or something like that, then that would be risky for you. History of stroke would be another one. If you've had blood clots, not like menstrual blood clots, but like a blood clot in your leg or a blood clot to your lungs called a pulmonary embolism. So a DVT is what we call the blood clot in the legs or a pulmonary embolism. Or there are certain disorders that put people at risk for blood clotting. There are certain protein deficiencies and these sort of rare diseases or disorders where people have to be on blood thinning medication. And for those people, it wouldn't be safe. Certain cancers, so if you have personal history of breast cancer or other hormonally sensitive cancers, then it wouldn't be a good idea to give you hormones. Family history is actually okay. And there's pretty good data that even a strong family history of breast cancer is really not a reason not to take hormone replacement therapy, as long as you don't carry one of the genetic markers for cancer, the BRCA or the Lynch syndromes. Are probably the two most common ones. And you would know that if you had that. So those would be some of the big things that would preclude you from using hormone replacement therapy. It just wouldn't be safe. The other thing is you ought to have some symptoms. So the idea is to improve your quality of life and get you feeling better. So if you feel great and there's no change, then it's sort of silly to take a medicine that you don't need.
Right.
And there are some people that ask about that because there are some, benefits beyond symptom control. But probably, unless you're having some symptoms, it's probably not worth messing with taking medications every day. But if you're having symptoms, then certainly this is something that can be very helpful.
So just for clarity, what type of symptoms does hormone replacement therapy help with?
So there's actually a much bigger list than you would think, or maybe not, but bigger than I would think. So I won't go through, the 100 different possible symptoms, but there's some obvious ones. The hot flashes and night sweats is the most sort of common one, the one that we talk about most. And so those are really easily relieved usually with hormone replacement therapy. It can make a big difference for women. But it's surprising to me at about less than 50% of women have hot flashes through this menopause transition, which kind of surprised me when I saw that data, but it seems to pan out in our patient population. So you don't have to wait for hot flashes to start hormone replacement therapy. That's just the sort of most common one and the one that people talk about the most. Sleep problems are very common. Now, if you had sleep problems all your life, probably not going to help. But if everything was fine and all of a sudden you get to a certain age and now you're not sleeping well, it very well may be your hormones. Brain fog is another one. And this is a big problem because the sort of age group of women as they go through the menopause transition is the same age group when people are really sort of, really getting into that spot in their career where they're moving up and they really need to be operating, at 100%. And all of a sudden now they're getting this brain fog and they're forgetting words and they're forgetting things. And hormone replacement therapy can really help that quite a bit. There are other skin and hair changes are very common, and hormone replacement therapy can give you younger looking skin, thicker, healthier hair. So those can be really important for people. There are also vaginal changes that take place. People can start having vaginal dryness, pain with intercourse, bladder changes because of the vaginal changes. Maybe you're getting up all night to pee, or you're feeling like you have to urinate all the time, or even leaking urine during the day or at night, or when you cough or sneeze. Hormone replacement therapy can help with that as well. So those are all some of the symptoms. There's a whole lot more. Certainly, mood changes can certainly happen. Anxiety and depression are very common. So those are, other symptoms. But those are all sort of a cluster of symptoms that we see.
Excellent. Because I know that a lot of times people really just equate the hot flashes and the night sweats and the not being able to sleep with menopause. But you're right. There are so many other things that happen in all those changes in your body, including that spare tire that ends up around your midriff. So
that's actually a huge one, and I forgot to mention that. Yeah. So all of a sudden, you can't get weight off like you used to, and your body changes from being like an hourglass to an apple. That's a very common change that occurs that hormone replacement therapy can help with.
Yeah, so most women, that's the first one that they think about.
That actually probably is the biggest one.
Looking to take the important steps towards a slimmer, healthier you? We're here to help. NeoraFit combines a line of innovative dietary supplements that support your body around the clock with sustainable lifestyle habits that help you achieve and maintain your fitness and weight loss goals. We've spent years researching the right ingredients and technologies to help support a sustainable, fit lifestyle. Not only are these products true to our promise of providing natural and clean formulations to provide you with scientifically backed results, but we've combined the product with a program based on the principles of the book, The Slight Edge, giving you healthy daily disciplines that help you compound your results over time. And we've also developed a support system to share fitness knowledge and encourage you every step of the way. Back to the show.
So what age is there an age? You said after 60, which kind of disappoints me because I'm just a little after 60. But is there like a start age or an average age where you would expect to start to see some of these things where hormone replacement therapy might be beneficial?
Yeah, there certainly is. So the average age of women completing menopause in the United States is about 51. But about 10 years before that is when symptoms start showing up. The interesting thing is that about 15% of women will complete menopause by 45. So if you count backwards, that means starting at 35, people can start experiencing these symptoms. It's really not as uncommon as you would think. So there's these really relatively young women that are experiencing these things, but their friends, themselves, even their doctor are poo-pooing it. You're too young for that to be. It's like, well, not necessarily. So it's something to think. So really sort of 35 to 59 is a time to think about it. There's some really important data that the earlier you start this, the better it is for your overall health long-term. There was a really interesting article that came out a little over a year ago it came out by the cardiology people rather than the gynecologists, that basically said that hormone replacement therapy is cardiovascular protective. It helps keep your heart healthy. But if you wait too long to start it, it's too late, and then it sort of does the opposite. And that's where this age 60 cutoff is. And so they say, really the earlier you start it, the more benefits you get for your heart health. So for OBGYNs, each specialty, you have to recertify your boards one way or the other. Some people have to take a test every 7 years, or there's different ways that's done. The way they do it for us, which I think is a pretty good way, is they hand us a bunch of articles. These are the important journal articles over the last year that we think you should have read. Read the articles, and then there's a little test, an open book test on each article to prove that you read them. And this was one of the articles that they included in the packet last year. That's how important of a study this was. So it really was sort of groundbreaking. It's like, wow, we really don't want to miss the boat here. If we wait too late, we lose a lot of benefit from this. So waiting, some people think, well, yeah, I'm having all these symptoms. I'm having the brain fog and the sleep problems, and and the tire in the middle, but I want to wait to put off starting hormone replacement therapy as long as I can. It's like, well, actually, the data says you're better off doing it the other way. Not only do you get the heart benefit, but why suffer with the symptoms if you don't have to? So it's actually safer to start earlier.
Well, that's really interesting because I am in my 60s, and a lot of my girlfriends are looking at hormone replacement therapy now. There's a bunch of different things that are out there. So you're saying that you shouldn't be doing that. So if you were smart enough to get started, say in 45, that means you stop at 60. Is that what you're saying?
No, not really. So 60 is when, after 60, starting it for the first time carries some risk to it.
Gotcha.
If you're already on it, and it really has to do with this heart thing. So if you've already on it, you've had this protective benefit. And so it's much safer for you after 60 than someone who's never been on it before, because they've had this sort of collective, small but incremental decrease in their heart health over time. And now you're starting it in somebody who, we said heart disease was one of the reasons not to start it. And even though you may not have been diagnosed yet, statistically speaking, there's a good chance there's something going on there, or at least enough of a chance that it can be a problem for you. So, and in fact, in the big study about this, it turned out that women that started hormone replacement therapy later, the first 2 years had some risk of having, a significant problem. It wasn't huge. It was less than 1%, but it was there. Once they got past those first 2 years, then the risk went back down to people, the same as if they had started it earlier. So it's like, if you can get through those first 2 years, then you get the benefit from it and you do okay. So as a rule, that's sort of where we draw the line. But I think, you can have a conversation with your doctor about it. There's something called shared decision-making, which is really important in healthcare. And that is the old days of the doctor just handing you a prescription saying, this is what you should take, no explanation, no conversation. Those days are over, fortunately.
Thank God.
So now, the way we practice medicine, or the way we should practice medicine, is as an educator. I see my job really as a patient educator. My job is to explain what's going on in a way that you can understand, give you the various options, try to explain, the risks and benefits of the different options, and then for you to decide what's going to be best for you. We have a conversation. We call that shared decision making. And it's a better way to practice medicine, because ultimately, it's not the doctor that gets the benefit or suffers the consequence. It's the patient. And so they ultimately have to make the decision of what's right for them, but they can't make that decision unless they get good information that can educate them to put them in a position to make a good choice.
Right. You always have to be your own best advocate.
100%.
I would totally agree with that. Well, time always flies when I'm talking with you. There's so much to learn. And I'm sure, listeners, that you are probably going, I never knew those things. Or you might have even discovered a few of those symptoms that you've been experiencing them and not really thinking too much about them. Maybe it's time to go speak with your doctor about it. But if you don't have a doctor who's open to that, Dr. Green's contact information will be in the show notes. And be sure to go back and listen to our first episode where we talk all about the history of hormone replacement therapy, and look forward to our next episode where we're going to debunk some of those myths.
Do you think one of the biggest advantages to aging is all the knowledge we gain along the way? Me too. What did you learn today? Share with me in my Facebook group with the same name as this podcast, Advantages to Aging. Now hit subscribe so you don't miss all the tips to come in future episodes.